Hi, I'm Dr. Sung W. Kwon. I'm a board-certified vascular surgeon at Jersey Coast Vascular Institute here at Ocean Medical Center. Carotid artery disease, in essence, is a blockage of arteries in the neck which supplies the blood flow to the brain. If it gets cut off or blocks off, it'll basically cut off the oxygen and nutrients. The process then could damage the brain tissues, and the process is called stroke. As the blockage gets worse, you could actually develop a symptom, things like paralysis, or weakness or dizziness, or you could be blinded, or you could have difficulty with speech. Now these symptoms could obviously last longer, or it could be very short-lived, from few minutes to few hours. And those symptoms that last only a few minutes, few hours are called a mini stroke, or TIA, or transient ischemic stroke, or ischemic attack, and basically is a warning sign or prodrome for an oncoming major stroke. Typical patients with carotid artery disease are patients who generally forms atherosclerotic disease or hardening of the arteries. And these are the people who have diabetes, high blood pressure, high cholesterol, obese patients, a person who has unhealthy health habits such as smoking. Any plaque formation in the carotid artery is considered carotid artery disease. Now there could be mild disease, less than 50%, and obviously in the mid-range of 50 to 79% called the moderate, and then beyond severe or critical disease. Once it gets to 50%, the treatment depends on your symptoms. If you're without symptoms, usually it still gets monitored on a routine basis frequently, every 6 months, and continue the medical therapy. If you develop symptoms such as TIA or stroke, those folks are basically offered surgical options. And there are two surgical options. One is called carotid endarterectomy, which is basically open surgery. Skin incisions are made directly over the artery and the plaque is removed entirely. The other option is called carotid artery stenting, and these are minimally invasive procedures. Basically, thin wire and the catheter is threaded into the carotid artery, usually from the groin, and stent is usually placed. The long-term prognosis is quite good. The recurrence is quite low. People do, for majority-wise, do extremely well. Carotid artery disease is a serious health problem. With proper diagnosis and prompt treatment, you could prevent a potential catastrophic symptoms or disease such as stroke.